It's crunch time on health care, and President Barack Obama is taking his push for an overhaul on the road. While lawmakers haggle over competing plans, the president's enlisting average Americans with tales of a system they can no longer afford.
Having cancer will totally change a person's life, but having to deal with all sorts of financial issues because of it is devastating.
At a town meeting, Obama heard a mother describe unpaid bills spreading as fast as her lesions.
Now, Laura's story is incredibly moving, but sadly, it's not unique. Every day in this country, more and more Americans are forced to worry about not just getting well, but whether they can afford to get well.
It's clear Congress is feeling the heat.
It's not only unacceptable that the system exists as it does today, it's unsustainable.
Even as it struggles with the massive cost of covering everyone.
I'm a little bit worried about how we pay for it, because I think America realizes that we've kind of maxed out the credit cards.
And most Republicans staunchly oppose Obama's call for a government health plan to compete with private ones.
It amounts to a government takeover of health care, and it would force millions of Americans off their own plans and into a government-sponsored plan.
Obama argues a public plan of some kind is vital to reining in cost. Plus, he asks the doubters, what's the alternative?
What else do we say to all the families who spend more on health care than on housing or on food?
Next week, the president's health care roadshow takes him home to Chicago and a speech to the American Medical Association. That doctors group says it wants his push to succeed, but it has major concerns about his public health insurance option. Mark Smith, The Associated Press, Washington.